Success with Diabetes, Diabetes Medications, Session 5. Today, we'll talk about the oral and injected medications for diabetes. We'll briefly go over medications for high blood pressure and cholesterol. We'll address some misconceptions about taking medications, and we'll discuss how to overcome barriers to taking medications. What happens in type 2 diabetes? Do you remember the lock and key analogy? The pancreas does not produce enough insulin, and the liver sends too much sugar into the bloodstream. Other cells in the body are not using the insulin correctly because the lock has been changed where the key doesn't work anymore. This causes insulin resistance. Glucose can't get into the cell, so it stays in the blood. Why is it important to take medications for diabetes? For some people with diabetes, nutrition changes and physical activities aren't enough to manage blood glucose levels. Taking pills or injections, like insulin, does not mean that the person has failed to take care of their diabetes. Medications are used to help manage diabetes by reducing blood glucose levels and to reduce complications from diabetes. There are two forms of diabetes medication: oral and injectable medication. Oral medications are ones you take by mouth. Injectables are the ones you use a needle to inject into the fat under your skin. There are many types of diabetes medications, and different classes of medicine work differently in the body. To make things simple, we'll just go over the 5 organs that these drugs act on. Some medications help the pancreas produce more insulin. Other medications help muscle cells better use glucose, making it more sensitive to insulin, thus lowering the amount of glucose staying in the blood. There are other medications that decrease the liver's release of sugar stored. Some drugs can decrease the intestine's ability to absorb sugar, so less sugar will go into the blood. There are also medications that help the kidneys get rid of excess sugar in the blood through secreting via urine. As we mentioned before, your pancreas normally makes enough insulin. If the pancreas does not make enough insulin, insulin is available for you to use as a prescribed medicine to replace or supplement. Injecting insulin may sound scary and be difficult to do at first. However, most people are surprised how easy it is to use. What does insulin do, and why is it needed for some people with diabetes? Insulin helps sugar get into our cells. If you remember from session 1, insulin is the key that opens the door for sugar. It's needed for people with diabetes because they don't make enough. Insulin deficiency can happen in both type 1 and type 2 diabetes. Did you know that there are different types of insulin? They can vary depending on how fast they begin to work, how long it takes to have its maximum effect, and how long it lasts in your body. Why does insulin have to be injected? Insulin is a protein/hormone, so it would be broken down by our stomach acid if we take it by mouth. Where can you inject insulin? Insulin should be injected into subcutaneous fat, meaning the fat just beneath the skin. This tends to be in areas such as the abdomen below the belly button or the fatty parts of your upper arm or thigh. If you are prescribed insulin, your healthcare team will teach you how to inject insulin correctly. Do not inject into blood vessels. This is very dangerous and should only be done by medical professionals in an emergency setting. Some myths about insulin are: insulin can cause blindness and other complications. This is a myth because insulin does not cause blindness. Blindness can be a complication from undermanaged diabetes. In some cases, complications have already occurred before the start of insulin. Oftentimes, insulin was started too late. The timing between the complication occurring and starting insulin makes us think that insulin causes a complication. Air bubbles in the syringe are dangerous. This is a myth because air injected under the skin is not dangerous, but it is better to avoid air bubbles. If air bubbles are too big, it means you are not getting the full intended dose. Increase in insulin dose means that diabetes is getting worse. This is a myth because the amount of insulin that is needed corresponds to the blood glucose level. If you take insulin before eating, you have to increase the amount of insulin for a meal if you're eating more carbohydrates. For safety reasons, your healthcare team will mostly start your insulin dose low and slowly increase to avoid dropping your blood sugar too fast, avoiding hypoglycemia. Insulin causes weight gain. This may be true at the beginning of treatment because your cells are now able to take in the sugar. But a healthy diet and exercise plan can help keep you at a healthy weight. Relying only on insulin to manage your sugar is more likely to contribute to weight gain. Thus, some patients might be on multiple injectables and oral medications to help limit the use of insulin. What about blood pressure lowering medications? Similar to diabetes, people with hypertension or high blood pressure may not even notice that there's something wrong. They may not have any symptoms at all. It's important that you take medications to manage your blood pressure if you have hypertension. Even if you see that your blood pressure is in the recommended range while on medication, you will need to continue taking the medication, because without it, your blood pressure can go up again. Sometimes it's necessary to take multiple medications to manage hypertension. What does high cholesterol do to the body, and why is it important to keep track? There are two common types, HDL and LDL. LDL is bad cholesterol. When there's too much of it, it can stick to the walls of our arteries, causing them to become narrower. This can cause issues like heart attacks or strokes. Besides taking cholesterol-lowering drugs, you can reduce your bad cholesterol and increase your good cholesterol, which is HDL, by losing excess weight, eating a healthy diet, exercising, and managing your blood glucose. Your provider will always want you to be able to manage your cholesterol by making lifestyle changes. But sometimes your body may need extra help, so it's okay to take medications to help your body manage cholesterol levels. When you start a new medication to manage your cholesterol, blood pressure, or blood glucose, it's important to record your numbers to see how your body is responding to the new drug or dose. Let your provider know if you experience any new symptoms or side effects. You can always call or write these down on your phone or a piece of paper to bring to your next visit. Don't wait until you're almost out of medications or sugar checking or insulin injecting supplies to schedule a refill. Make sure you plan ahead so you don't miss any doses. Keep a list of medications you're taking. Include information like how much you need to take, when to take it, what it's for, which provider prescribed it. Also, ask your provider what to do if you miss a dose. Write down when you started using the drug and when you stopped. If you stopped a medication, make a note on why it was stopped. When should you contact your healthcare team about medication questions? Contact them anytime. It's important to take medications as directed. If you have any doubts or concerns, contact your provider before stopping any medication. Also, let your provider know if you take any vitamins, supplements, herbal remedies, or over-the-counter medications. Starting a new medication means you have to make adjustments to your daily life. What if you're experiencing some of the following common scenarios, like forgetting to take your medication? Well, putting your medications visible and set alarms or write notes to remind yourself. Try to establish a routine and form a habit. How about having to take medications during the day when you're busy? Well, you can talk to your provider about decreasing the frequency you have to take your medications or simplifying your medication plans. What about not being able to afford medication? Well, you can talk to your provider about a generic form that is cheaper. You can contact government health agencies to see if you qualify for any help or resources. Or contact manufacturers. They often have medication assistance programs in place. What if you're not understanding why you have to take these medications? You can ask your provider or pharmacist. What if medications cause your blood pressure or blood glucose to drop too much? Well, you can record your numbers and tell your provider. What if the pharmacy is too far? Well, you can ask your friends or family for a ride. Ask a medical social worker if you qualify for taxi vouchers or can get reimbursed for gas or ask for mail-in orders. Specific pharmacies do provide this service. Today, we went over medication. In the next session, we'll learn about how to live with a chronic disease like diabetes so it doesn't affect our quality of life. We'll talk about stress and what we can do to help manage it.